Hi, I'm Tanner Bleakley. I'm a certified athletic trainer with Memorial Health Systems Department of Sports Medicine. I would say the most important nutrients for high school athletes are the big three macronutrients, which are carbs, fats, and proteins. Carbs are your basic energy blocks. They give you energy. They should account for about 45 to 65% of your daily caloric intake. The next one is proteins. They're your rebuilding macronutrient. They help rebuild your muscles after athletic competitions and practices. That should take up about 10 to 30% of your caloric intake. Fats are next. That should take up 25 to 35% of your caloric intake. They're very nutrient-dense energy source. They also help you absorb vitamin A, D, and K. So they're very important for athletes. So a balanced diet should be able to handle all of your macronutrient needs. For carbohydrates, you have things like oats, beans, pasta, brown rice, yogurts, breads, fruits, vegetables, and milks. For protein, you have lean meat, poultry, fish, eggs, dairy products, bean, nuts. For your vegetarian student athletes, we have things like wheat meat or seitan, impossible meats, tofu, edamame, soybean-based, which actually is a whole source of protein. Lentils, beans, soy milks, oats, oatmeal, wild rice, nuts and nut butters, as well as avocados. Protein-rich fruits and vegetables, so broccoli, spinach, asparagus, artichokes, potatoes, sweet potatoes, and Brussels sprouts. For fats, you're looking at lean meat, poultry, fish as well, nuts, seeds, dairy products, and olive and canola oils. So for your pregame meals and snacks, you want something carb-focused with a little bit of light protein in there. So something like a turkey wrap or a chicken wrap. Fruits, vegetables are really good options. Something that doesn't sit in your stomach for very long and gets broken down and digested rather quick. Bananas with peanut butter, toast with a little bit of peanut butter on there, or any nut butter you're choosing. So for post-game snacks, you want to recuperate all of the carbs that you use during the event, as well as give your body more protein to help recover and rebuild your muscles after the event. So similar foods as far as turkey wraps, chicken wraps, fruit smoothies, as well as protein powder smoothies. And then also, if you want to use hydration boosters like electrolyte packets, those would also be a good source to help regain your electrolytes to refuel. So we just talked about the first pillar of athletic performance and nutrition. Now let's dive into the second pillar, which is hydration. So hydration is important because even at a 2% loss in fluids, your body will have adverse reactions through central nervous system fatigue, decreased cardiovascular output, as well as decreased endurance and performance on the field. Early signs and symptoms of dehydration include thirst, general malaise, headache, nausea or vomiting, lightheadedness, irritability, muscle cramps, difficulty paying attention, and just a general weakness and fatigue. So with hydration, it's important to be more proactive than reactive. General guidelines for kids 14 to 19-year-olds are 2 to 3 liters per day of water. But again, that all depends on the sport you play, the intensity or duration of the sport, your environment, outside versus inside, like a volleyball. So sports drinks can be beneficial if they're used correctly. Things like Gatorade and Powerade, those are primarily used during your competition to keep the carbs inside you, keep your energy up. Things like Pedialyte and Gatorlyte, those are more after the event to replenish your lost electrolytes. So we just talked about 2 of the 3 pillars of athletic performance. Now to talk about the third pillar, sleep, here's Abby.
Thanks, Tanner. My name is Abbigail Thorn. I'm an athletic trainer with Memorial Health System Department of Sports Med. So Tanner just told you about the first 2 pillars of athletic performance, nutrition and hydration. I'm going to talk to you about sleep. Kids in general need more sleep than adults. They need about 7 to 12 hours, but it can vary depending on their age and activity level. Athletes specifically need in that higher range from about 9 to 12 hours. So athletes have a lot of barriers to their sleep that are specific to only them. They often have early practice times and then late games. And when you add in travel times on top of that, they often aren't getting nearly the 7+ hours that they need a day. On top of maybe not getting the amount of time that they need, their sleep quality is also generally decreased because of some pre-competition anxiety or even the aches and pains that athletes experience every day. Cognition, reaction time, and ability to pay attention are all impaired when athletes have less than 7 hours of sleep. Also, dealing with an impaired immune system can result in a decreased rate of healing and an increased chance of injury. Increased problems with mental health, including depression and anxiety, also occur. When athletes are exhibiting less sleep than usual, parents and coaches might notice a lack of judgment, they may be more emotional, and they may just exhibit more sleepiness during the day. Although there are many things that athletes don't have control over as far as their sleep goes, they can set a schedule, get off their phones more than an hour before bedtime, and limit bright lights. Remembering the 3 pillars, nutrition, hydration, and sleep, will help keep athletes at their peak performance. As athletic trainers, we're part of your team, providing injury prevention, education, and guidance on and off the field.
For more information about sports medicine, visit our website at mhsystem.org.